During the Civil War, the experience and training of doctors wasn't well regulated. The Union Army only had 98 doctors registered, and the Confederate had only 24. Therefore, both armies were willing to take anyone who considered himself a physician. Most of these new doctors carried around a copy of a military surgery manual that had been written by Dr. Grease. Can you imagine being operated by a man who just read the direction? Because infection control was not a big concern during the Civil War, there were many diseases going around. Many doctors thought that pus was a good sign, so they would transfer from one patient who had it to those who didn't. Some of the major diseases that were going around during the Civil War was smallpox, malaria, and typhoid fever. Smallpox is caused by variola virus. This disease is highly contagious. You can get it by breathing in the virus during close face-to-face contact with an infected person. It's usually spread through drops of saliva when the person has cough, sneeze, or speak. About 3 million people have died from smallpox. Malaria is a mosquito-borne disease caused by a parasite. People with malaria often experience fever, chills, and flu-like illnesses. The soldiers were exposed to malaria when camping in damp areas which were collected by breathing mosquitoes. Malaria is not caused by a bacteria or virus. It is caused by a single-celled parasite. About 10,000 people died from malaria in the Civil War. Typhoid fever is caused by the bacteria Salmonella typhi. It is spread by ingesting food or water that is contaminated with this disease. People with typhoid fever often experience poor appetite, headaches, fever, and diarrhea. About 1/4 of the soldiers died from typhoid fever. Some of the most important medical advances during the Civil War were life-saving amputation, aesthetic inhaler, closing chest wound, and facial reconstruction. The first antibiotic that was discovered is penicillin. It was discovered by Alexander Fleming. Penicillin is often described as a lab mistake. On September 3, 1928, Fleming returned to his laboratory, having spent August on holiday with his family. Before leaving, he stacked all his cultures of Staphylococcus on a bench in the corner of his laboratory. On returning, Fleming noticed that one culture was contained with a fungus, and that the colony of Staphylococcus immediately surrounding the fungus had been destroyed, whereas other Staphylococcus colonies further away were normal. Penicillin helped reduce the number of deaths and amputation of troops during World War II. According to records, there were only 400 million units of penicillin available during the first 5 months of 1943. By the time World War II ended, U.S. troops were making 650 billion units a month. Over the years, people would repeatedly use penicillin for all types of illnesses, which would cause the bad bacteria in their body to be immune to the penicillin. Exarch Philip, a Hungarian physician, made an important discovery in 1847. He proved statistically that childbed fever could be dramatically cut by use of hand washing standards for doctors and nurses in clinics. Keeping your hands clean is one of the most important ways to prevent spread of infection and illnesses. You should wash your hands before and after you eat, after using the bathroom, after blowing your nose, coughing, or sneezing, or whenever you contaminate your hands. Antibiotics work by blocking vital processes in bacteria, killing the bacteria or stopping them from multiplying. This helps the body's natural immune system to fight the bacteria infection. Here are a list of antibiotics and what they are used for.
Antibacterial-containing products have not been proven to prevent the spread of infection, better than the products that do not contain antibacterial chemicals. While it is clear that antibiotics are pivotal in the selection of bacterial resistance, the spread of resistant genes and of resistant bacteria also contributes to the problem. Selection of resistant forms can occur during or after antimicrobial treatment. Antibiotic residues can be found in the environment for long periods of time after treatment. Some bacteria have developed resistance to antibiotics that were once commonly used to treat them. For example, Staphylococcus aureus and Neisseria gonorrhea are now almost always resistant to benzyl penicillin. In the past, these infections were usually controlled by penicillin. Some bacteria that are capable of causing serious disease are become resistant to most commonly available antibiotics. Antibiotic-resistant bacteria can spread from person to person in the community or from patient to patient in a hospital. They're dangerous because they adapted to the antibacterial resistant and that they're becoming stronger. Good personal hygiene will minimize spread of the bacteria of the community. Careful prescribing of antibiotics will minimize the development of more antibiotic-resistant strains of bacteria. Antibiotics are often misused by doctors, patients, or even people raising animals for meat. And that misuse, which includes prescribing or using these drugs incorrectly, breeds superbugs. Antibiotics also kill off some of the good bacteria that normally live in your intestines, which may allow resistant bacteria to fill the void. Those bacteria can then multiply and transfer their drug resistance to other bacteria, magnifying the problem. Use good hygiene. By washing your hands often and thoroughly with soap and water, you are helping to prevent disease and therefore the need of antibiotics. Additionally, cooking meat thoroughly and handling food hygienically will help to prevent foodborne illnesses. Also, you should take antibiotics only when necessary. Probiotics can have a part to play in slowing down the spread of antibiotic resistance. Certain strains of probiotics have been demonstrated in clinical trials to prevent the side effects associated with antibiotics. Lactobacillus acidophilus roselle 52 and Lactobacillus rhamnosus roselle 11 were given to 20 children suffering with respiratory tract infections alongside their antibiotics. The trial showed that none of the children suffered any intestinal complaints during the treatment period and their intestinal flora remained normal throughout.